episode of Oh My Gut. And today I have a really close friend, Brendan, who is joining us today. He's a doctor, medical doctor, and he's someone who is known as a lifestyle doctor. So we are here to find out more about gut health and how our gut is linked to diseases. Our gut is also linked to immunity. So before we go into those deeper topics, deeper questions, let's find out more about Brendan first. So Brendan, could you give us a short introduction?
So my name is Brendan. I'm a medical doctor. So I would say that medicine has always interested me, and ever since becoming a general practitioner, my practice has become more than just health and more about overall well-being of my patients. A lot of times it's mental, a lot of times it's lifestyle, gut-related, non-gut-related, all of this. But I take care of that.
So how long have you been in the practice, and in this journey, what were some highs and lows that you've experienced?
Well, I've been practicing for about probably 5 coming to 6 years now. Okay, and it's been an interesting journey. I think when I was first coming out of medical school, you're armed with a lot of medical knowledge, but not necessarily people skills. Although I think I have people skills. Okay. Mileage might vary, but I think the ongoing learning process has been fruitful, and it's been a gradual process and ongoing process of figuring out what your patients want, how to talk to them, how to counsel them, how to help them, especially with a lot of lifestyle issues that medicines cannot touch. So that's been an interesting journey as well.
I like that you mentioned that, because from there I have 2 questions to dig a bit more.
Sure.
So the first one is, what would you say are the more common issues, the more common type of patients that you see? And also then, maybe that one first, then I'll have a follow-up question on that.
Okay. The most common for any general practitioner is still going to be acute medical issues. Acute medical issues is anything running from your cough, flu, runny nose to your diarrhea, to pain, back pains, and things like that. And all of this has medical causes, but also lifestyle causes as well. Okay. Then for the chronic medical conditions, which we see very, very commonly as well, most of them actually are rooted in blood pressure issues, cholesterol issues, which actually still all tie back towards lifestyle in terms of being overweight, and also in terms of being very sedentary. And so these are the most common things that we see every day.
Right. So you mentioned a lot of things are linked back to lifestyle, right? So when you are trying to educate or coach your clients back into health, what would you say are some things you would recommend in terms of lifestyle prescriptions? And how easy or difficult is it to follow, and do they listen to you?
So that's a very good question, actually. In terms of what we prescribe, beyond just the usual medications that we give, okay, the advice I usually give is going to be to have an active lifestyle. And active lifestyle doesn't mean, you're once in a month trying to run a 5K or 10K, okay, but something that you can do that is achievable for you, that you're comfortable doing, that you are interested in.
Not too extreme.
Not too extreme. It's really consistency is key. And in terms of active, it can be running if you're into that kind of things, but it can also be a group sport, because I think people tend to enjoy that a little bit more. Okay, or even if it's just an afternoon walk. You can walk for half an hour, 1 hour. That'd be great as well. Something to keep you from sitting in a chair like we are doing right now. Okay, that would be very, very good.
So we should be walking and having this interview.
That's right. And also, I think a lot of times, lifestyle-wise, it's also about what you eat. Okay, so it's also about basically incorporating colorful vegetables in your diet to get your vitamins, you can get your minerals and all those kind of things. Okay, and also in terms of being aware of their health. Okay, just telling them what they should be watching out for in terms of when to do their health screening, and how often to follow up with the doctor, things like that. Those are very important as well. And I'm going to go back to diet. The other thing I forgot to mention as well is I always tell people what beyond just the vitamins and minerals, as well as about what to look out for in terms of choosing the right sauces, reducing their sodium intake, those kind of things that are linked to high cholesterol, high blood pressure, this kind of stuff.
It's not easy, right?
It's not easy. You asked me just now, I forgot to answer you. Basically, whether or not the patients listen.
Yeah.
Right? So I would say that every patient comes with their own set of beliefs and their own set of and their own current lifestyles. So it varies. Some patients are very, very, very ready to change, and their readiness to change can come internally or externally. Some of them come just for maybe their regular health screenings, and then you realize that you have cholesterol problems, you're very close to being pre-diabetic, And by the way, your BMI is 30. Okay, so a lot of times they come without the mental preparation of something needs to change. So then it's a longer process of trying to figure out their motivations. So it's a lot of actually managing emotions and managing motivations rather than managing the health sometimes.
You're more like a counselor.
In a way, yeah. And I would say that I think it's quite impossible to be a good doctor without being a good counselor.
A little bit of a personal question where I used to not like to go to the doctors because my previous history was psoriasis and hives, and doctors always prescribe me with like antihistamines or steroid creams and stuff like that. And I've gone through my journey. People who watch us know that I've healed it through dietary changes, lifestyle changes. So I know that it's important to eat the rainbow and stuff like that. So I've also heard that medications have a very negative effect on our gut, especially antibiotics. So I heard somewhere, correct me if I'm wrong, that a course of antibiotics can cause us to like rid off our good bacteria for 2 years or something like this. So we have to like put in more probiotics. So what are your thoughts around like medication and how it can affect our gut? Because I'm sure we'll get to it later. Our gut health is like a key component, right, of like overall wellness.
So in terms of being comfortable with talking to a medical doctor about your issues and then about your experiences with taking medications or not taking medications, I think at the end of the day, to have a really transparent and good understanding of health is still important to share. Okay, some doctors may not be so open to agreeing or not agreeing whether or not non-medical or non-medicine related measures can improve your health. Okay, but I think most of us are cognizant of the fact that some of these things are actually quite effective. Okay? If you bring it up, then you can have that conversation. If you don't talk about it, then you will not know whether or not your doctor is open to that. So sometimes when I go through medical results, especially cholesterol results with some of my patients, and I ask them, also, are you on any medication? Okay, then they will say no. And then sometimes I can sense that they want to say something more. Okay, and then so I'll ask them, are you on fish oil? For example, and a lot of them will be like, oh yes, I'm actually on this, okay. And then after that, I realize that they're not just on fish oil; they're usually on vitamin C as well, all kinds of other things. Yeah, and then that's how to broach the topic. So sometimes, from the doctor's point of view, we can also make that more, I suppose, easy for the patient to share. Okay, but that everybody's experience varies, and it's always about how the conversation flows. But if you're open, then your doctor will be open. Yeah, but if you're closed, then your doctor will not want to ask more. So it's also about that as well. Then for the second question of whether or not medications have side effects, whether they are beneficial or harmful. Yeah, so it is a mixed bag. Okay, so we prescribe medications because we know that they help for certain situations. Okay, for example, antibiotics help for bacterial infections. Okay, but why are we so, I suppose, restrictive about prescribing antibiotics these days? Because we know that antibiotics also have their own side effects. Okay, so yes, you are right in terms of some bacteria. They do kill all bacteria, regardless of whether the bacteria is good or bad. Okay, they will kill the bad bacteria, which is good for the bacterial infection that you are fighting. But they will also kill the good bacteria, which is why sometimes when you take medication like augmentin or amoxicillin, one of the side effects is diarrhea. Because your gut bacteria is like the good gut bacteria is being killed. Okay, and so therefore we routinely tell people, by the way, you might get a bit of diarrhea with this medicine. It's okay, you should recover. I wouldn't say that definitely it takes 2 years to replenish the gut bacteria. It again depends on your lifestyle and your diet. Okay, but it is something to be mindful of. And just beyond killing good bacteria, there are other medications, like for example some strong painkillers or some oral steroids which you might have been prescribed before that can cause gastric because they can affect your stomach lining. So these are the other parts of the gut health that might be affected as well. Yeah, so yes, it has its I suppose disadvantages as well. Yeah. But usually when we prescribe antibiotics, it is for a reason. We think that the benefit is more than the risk. So that's a conversation to have between a doctor and a patient.
And usually it's a short-term course, right? And then that's where your lifestyle advice will come in. Like, okay, besides doing this, you can increase this in your diet, do less of this, eat more of that kind of thing. Yeah. From someone who don't like medicine, right? So I just want to ask and be that person wearing the black hat. Like, are there medications that are just, that have other side effects? They are just not good for you, and or maybe it's not even just about gut health or like reading off your bacteria, but it's more than that, especially long-term medicines.
Well, I would say that I wouldn't. Okay, so no drug company will come out with a drug to harm you, right? It's always from the point of view that this will help you in this particular condition. Okay, so a very common chronic medication that we put patients on is actually aspirin. Aspirin is a blood thinner, right? So aspirin is used for people with ischemic heart disease or blockages in the heart, or maybe previously had a stroke. Okay, but aspirin causes gastric bleeding. Okay, or it has one of those side effects. It might cause gastric bleeding. So then the other medication we have to put them on in the long term is something to protect the gut. So it's like one leading to another. So it might not harm you, but then it's like maybe it's causing, but we think that it's causing more good than harm. So it's like, we're always as doctors balancing what we think is good for the patient and then all these potential side effects that can occur. And that's the reason why for chronic medicines, as you brought up, we never just give them the medication and just say, oh. Right? We always say, okay, you got to come back in a month, come back in 3 months. Because we're always monitoring for all these side effects that we know may occur. And then if they do occur, then we can change them to something else, okay? Or just adjust, other things in their life to make it more, I suppose, adaptable to that. Okay? So that's medications in a nutshell. I mean, we give it for a reason, we change it for a reason, okay? But we have reasons to do that.
If you have questions on that, or if you have more, like thoughts around the medications that you are taking or you want to ask about, just let us know. Or if you want to totally know about a new topic, just let us know as well. So these are good inspiration to create future episodes. So if you want to see Dr. Brendan again, just let us know. But yes, I also want to ask about, because not just in the medical field, but in other fields as well, like fitness and wellness, we always take extra courses, right, to keep up to date on maybe new research and to be in touch with all these topics and this knowledge. So I wonder, would there be more of modules along like lifestyle and even like gut health, because it's very well talked about now. So I wonder if you have courses like that.
Yeah. So yeah, definitely. So as doctors, we always have to update our knowledge because as we all know with COVID, so many new research has come up in the last 1.5 years. Okay, same with actually all the other parts of medication. There's always research coming up, new topics, or even a new spin on old topics and all of this. So we usually attend a few courses or webinars or seminars about all these things. Okay, so one of the more interesting, I think, courses that I attended in the last 1 or 2 years is actually about obesity management. Okay, and
why
also,
you point at me?
because it's something that we discussed. Right? Don't take it personally. All right. But yeah, so actually obesity management was very interesting because that whole seminar is about how exercise prescription and lifestyle prescription should be used more routinely rather than jumping to medication. Yeah. So it was quite new because it's not something that we would have learned in medical school at all actually. I mean, we always say the same things about be active, eat more of this, eat less of that, but we are not so I would say specific about the exercise prescription and also the follow-up process because it's more of a soft science, managing lifestyle. Again, as well, all doctors have different interests. So some doctors will be more interested in all these kind of causes, some of them will be interested in other causes, so that makes us different. We are same but different as well. Yeah,
exactly. Yes. Okay, so you mentioned COVID and then there's a lot of research coming up. So I heard a podcast recently and they talked about the gut immunity axis. So I think I've heard about the gut-brain axis quite often, but gut immunity, so can you touch on that as well?
If you think about immunity, and you put immunity, or you think about immunity as like a shape or symbol, what do you think about usually?
I think about, what do I even think about? A myriad of things. It's just very complex.
It's very complex, right? Yeah, but like sometimes, but for me, like if I think about immunity, I usually think of like a shield. Like that's like the picture that comes to mind. A shield, right? Because your immunity helps you block off things, right? So your gut works as your shield because number one is the biggest organ in your body. If you stretch out your intestines, it's bigger than, it goes for miles and miles, right? Okay. So the gut immunity axis, exists because your gut is literally your shield. You put something into your body, your gut decides what to keep and decides what to excrete, right? So number one, it works as a barrier that way. Okay? So that axis is actually very complex and very difficult to explain in just a short amount of time. But typically, you think about your gut as filter, and you also think about your gut as something that, while filtering, so let's say if you accidentally allowed something that was not supposed to be absorbed to absorb into your bloodstream, that has knock-on effects. So those knock-on effects can cause inflammation, basically a whole myriad of hormonal changes, things like that, correct? Yeah. And this can activate or deactivate your immune cells. And actually within your gut and within your intestines, there are immune cells as well. So depending on whether or not these immune cells are rightfully or wrongfully activated, then they can cause a whole host of symptoms and a whole host of complications as well. So if you want to talk about gut immunity axis, that's kind of it in a nutshell. Do you have anything specific to ask me about that axis?
Wow, no, now that you mentioned shield, it's like, wow, knight in shining armor.
Yeah,
so we have to treat our gut as our knight in shining armor so it can protect us. Another thing I've heard is boost versus balance.
okay.
So because throughout this period, a lot of people have ways they want to boost their immunity, right? So I read in a wellness report and they said that over boosting is also not too good. But it's more about balancing, immunity balancing. So tough question, suddenly spring on it, but it just came to mind.
When they were referencing over boosting your gut immunity, what were they referencing it? Like, in what context?
They were referencing it in terms of a lot of immunity products are now out in the market, right? And I want to take these. I have 5 things I take to boost my immunity because of I'm afraid of the virus, and perhaps even pre or post vaccination I want to boost my immunity. But then that is an overactive, right, immune system.
So since we're talking about COVID, one of the most common questions nowadays that I get when patients are scared of COVID, they ask me about vitamin C. Okay, so vitamin C, we know for good or bad reasons, okay, that it is something that may increase your immunity. A lot of people are taking it now because they want to boost their immunity to help them fight infections.
Yes.
Okay, but the way that vitamin C works is via this process called neutralizing oxidation. It's very scientific.
Neutralizing oxidation.
Essentially, oxidation or pro-oxidation is a process where your cells get destroyed through that process. Okay, and so vitamin C is an antioxidant that fights against that, right? So it neutralizes this bad activity that happens in our body. But if you take too much vitamin C, it can actually turn into a pro-oxidant, where it turns into something where your immune products is actually making you worse off than you originally are. So that's why I think the balance comes in, where you have to take it as prescribed, you have to take it as per the guidelines, the right range, don't overdo it. I think everything in our life is really about balance. There's, I don't know, is there anything that you can think of where you can only have more of?
You can have in excess and love.
That's fine. Yeah. I think you're right.
I think that's the only thing. Even water, you can't overdo it.
Exactly. Yeah. So we should all love ourselves more. Yeah. Right.
Let's give yourself a hug. Alright, so now that we know we should love ourselves, I have one last question for Dr. Brendan, and this relates to how can you tell if someone has a good gut, or like someone is very, very healthy? Can you tell?
We can approximate your health, your gut health, by seeing whether or not you have symptoms. So for example, do you suffer from constipation? Do you suffer from chronic diarrhea? Do you suffer from abdominal pain? Do you suffer from bloating? Okay, how's your sleep? How's your mood? All these things, because your gut, as you know, it is related to your immunity, it's related to your brain, it's also related to your poop, for sure, right? So all these things are just things that your doctor will ask you if you come for a checkup or something like that, to get an idea of how you're doing as well. Also, it's important to know your diet, because if you have a bad diet, most likely you have really bad gut health. Okay? But everybody has different tolerances, to having symptoms. So some people might be more blessed. You might be able to eat everything and anything and have minimal symptoms, but that might not mean that it's good for your health. So there is a soft way to do it. There's also some things that you can do to qualify. Okay, but it's a very overall picture to tell whether or not you have a healthy gut, or whether or not your gut is causing you problems.
Okay, I lie because I have one last question.
Okay.
Now that you talked about poop, so my friends and I, one of the things we love talking about is the number that corresponds to our poop. So the poop chart.
Yes.
I don't know why, but we love talking about it. Like, oh, are you a 3 or 4 today? Or, oh, you're a 1. Then we judge each other, right? So, do you prescribe checking your poop beyond just looking at it? Do you prescribe like stool tests to your clients? Or?
So right now, for stool tests, when you talk about stool tests as a doctor, typically we're talking about testing for cancer. We're talking about testing for whether there's blood in your stool, okay, so that we know whether or not we need to go for any follow-up treatment or follow-up investigations, okay. But in terms about the chart that you're referring to, which is a Bristol stool chart,
Yes.
right? There's a very good way to tell whether or not you are suffering from constipation or whether or not you're suffering from chronic diarrhea, okay. So things that can cause constipation is, you know, very sedentary lifestyle, lack of fiber in your diet, lack of hydration, and then on the other side, chronic diarrhea. Things that can cause that will be perhaps taking too much oily food in your diet, okay, and also some other medical issues with the gut. Okay, so this is a good way to tell whether there's anything going on, but it's not the only way to tell. But if you are consistently a 3 or 4, that's pretty good. Yeah. And if you find days where you're like a 1 out of nowhere and it's persisting for some time, then perhaps you should go and see a doctor and find out what's going on. Do you need to do any further tests, or whether or not you just need to talk to a doctor about it?
I think it's best always to end off with poop. So this would wrap up our discussion today. I'm sure we can go on, and there's so many things we can talk about. But if you are interested to learn more about stool testing, to find out more about your gut health, the different bacteria, and know what you should take more of or less of, you have to visit OSbiome. So details are here. And if you have any questions, you have any things you want to learn more, please let us know, because we are here to really share and to help everyone, right? And if you like what you hear today, you think someone can benefit from this, do share it with someone, do like and subscribe so that we can continue to build this community together. And we will see you in the next one.